Hi, this is our group. This is our presentation. It's on alcohol withdrawal. Beep, 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 beep. Nobody was intoxicated in the production of this presentation.
When does alcohol use go too far?
Here's the real question.
What's the dysfunction with your consumption? There's acute alcohol use, and this can be referred to as binge drinking, or 4 to 5 red Solo cups at a time.
Then there's chronic alcohol use. Like this guy coming home from work, drinking 4 beers a night, every night.
This is his wife. She's coming from work, and she has a bottle of wine every night.
But they still go to work, take care of their business, because nobody detects the underlying biological havoc that booze is wreaking on their increasingly alcohol-dependent bodies.
On average, women who consume 2 to 3 drinks a night and men who consume 3 to 4 drinks a night may experience the subtle signs of alcohol withdrawal.
Based on recent animal studies, research suggests that binge drinking in the long term is thought to be more likely to result in brain damage than chronic alcoholism.
But caution, this is only an average, and it really depends on your patient.
Such as age, gender, weight, family history, concurrent medication use, and nutritional status all influence the effects of alcohol on the individual.
Pathophysiology of alcohol withdrawal.
The brain does its thing by balancing neurochemicals of inhibitory and excitatory neurotransmitters.
The main inhibitory neurotransmitter is GABA, which is enhanced by alcohol, further decreasing overall brain excitability, and this produces what we call an alcohol buzz.
Chronic exposure to alcohol decreases compensatory response to receptors to GABA, causing increased tolerance. So what do most people do?
Drink more.
Alcohol also blocks NMDA receptors and over time makes them overly sensitive in the absence of alcohol.
When alcohol is cut off abruptly, these receptors become irritated and the brain is hyperexcitable. This produces risk for life-threatening neurological and cardiac electrical dysfunction.
So the signs and symptoms. First off, minor signs and symptoms of alcohol withdrawal.
These can occur while the person is still intoxicated. Tremulousness, anxiety, tachycardia, increased blood pressure, sweating, nausea, hyperreflexia, insomnia, and increased brain activity without seizures.
These can also progress to severe withdrawal symptoms classified as major withdrawal syndrome.
Visual and auditory hallucinations, gross tremors, seizures, alcohol withdrawal delirium, prolonged QT interval, and these can all be life-threatening.
Some complications?
The kindling effect is a phenomenon that makes each attempt at detoxification more severe, lowering the threshold to tolerate normally weak electrical or chemical stimuli.
The potential consequence of this electrical sensitivity are behavioral effects such as life-threatening seizures and cardiac arrest.
While withdrawal symptoms are more predictable in patients recovering from chronic alcoholism, the electrical fluctuations of the kindling effect produce more volatile effects in those who engage in a binge drinking lifestyle.
And now for a special celebrity case study.
Meet our friend, Miss Winehouse.
They tried to make her go to rehab and she said,
No, no, no.
NCLEX alert.
Question: what was the cause of Amy Winehouse's untimely death?
A. Lifestyle. B. One crazy night. C. Heroin overdose. D. Congestive heart failure. Or E. None of the above.
The most correct answer is E. None of the above.
Amy Winehouse's cause of death is controversial, but the coroner report gave a verdict of death by misadventure, saying the singer suffered accidental alcohol poisoning when she resumed drinking after weeks of abstinence.
It's possible she resumed drinking the same amount she had tolerated prior to approximately 5 weeks of detox, leaving her neuroreceptors hyperreactive to the chemical alterations of alcohol.
NCLEX alert.
Question: what should Amy Winehouse have said to rehab?
A. Yes. B. Yes. C. Yes. Or D. All of the above.
The most correct answer is D. All of the above.
Other complications?
Another severe complication associated with alcohol withdrawal is Wernicke's encephalopathy, which, when untreated, progresses to Korsakov's psychosis. Thiamine deficiency from alcohol dependence can cause inflammatory, hemorrhagic degeneration of the brain that results in encephalopathy.
This is reversible with vitamin supplements, but if it progresses to Korsakov's, Korsakoff's, it results in irreversible amnesia and short-term memory loss.
Inpatient treatment. The gold standard for assessment and treatment of alcohol withdrawal in hospitals is the CWA protocol.
Using 10 categories scored 0 to 7, a patient's numerical total determines the severity of their symptoms and the necessary treatment. Benzos to the rescue!
Benzodiazepines, such as lorazepam, serve to suppress the hyperexcitable receptors in the central nervous system in the initial stages of withdrawal.
Antipsychotics such as Haldol can be added to treat delirium and refractory agitation.
Multivitamins, folate, and thiamine supplements are used to prevent further complications.
Social services are a valuable asset to facilitate outpatient support and recovery, whether alcohol withdrawal is the primary diagnosis or not.
The possibility of outpatient treatment.
Inpatient treatment is not an option for everybody. Under close supervision of a trusted adult, a person in stage 1 or 2 of withdrawal can be treated relatively safely treated at home, given that they have no significant comorbidities.
These patients should be in communication with a physician and have access to substitute medication. Caution: this option is not for everyone, as patients undergoing alcohol withdrawal are in a fragile biologic and emotional state.
Our role as nurses.
The nurse's role is multidimensional. According to Platzauer and Wilhelm, the nurse is responsible for preventing the progression of symptoms, providing for patient safety and comfort, and motivating the patient to engage in long-term treatment.
So what does this look like?
When you suspect alcohol withdrawal, family or friends accompanying the patient can be a valuable resource in obtaining information on medication history and alcohol consumption patterns.
This topic must be broached with sensitivity.
Make sure to inform the patient and family of the rationale for your detailed questions about the patient's alcohol consumption. The information they give you dictates treatment, not judgment.
You are the link between temporary, significant discomfort and possible recovery.
But do not fear, you are not alone. All of these professionals will play an integral role in optimal recovery from alcohol withdrawal and abuse. A primary care physician, nutrition therapy, psychiatry, case management, social work, including substance abuse treatment centers, and pharmacy.
We all have that person. It might be your mom. It might be your friend. They might be sitting right next to you.
If you or someone you love may be suffering from a drinking problem that we have talked about today, the Alcohol Recovery Hotline is available to you.